A patient in the emergency department who is being monitored with the portable cardiac monitor, a defibrillator, develops this rhythm. So, which action will the nurse take first? First, defibrillate at 200 joules. Second, start cardiopulmonary resuscitation. Third, administer epinephrine 1 mg IV. Four, intubate and manually ventilate. So, this type of question you see in the exam of NCLEX. To solve this question, you should know what type of ECG rhythm is. So, hi future nurses, welcome back to my channel. This is ManpreetRN Talk. So, if you are preparing for NCLEX, so video is for you. So, must watch. So, today we are going to break down ECG interpretation in the simple way so you can remember in a very clear method. So, many students thinks ECG is very difficult, but trust me, once you understand the pattern and the logic, it will be become very easy for you. So, grab your notes and keep writing. So ECG basically helps you to identify the life-threatening conditions such as the atrial fibrillation, ventricular tachycardia, ventricular fibrillation, heart block. So is ECG tells basically is the patient is stable or unstable, is this rhythm is shockable or non-shockable. So do we need CPR or DFib? So so NCLEX doesn't just ask what type of rhythm is, it will be usually based on the nursing priority and nursing action. So question comes like what will the nurse do first, which order is priority, when to give atropine, amidron or adenosine, and when to call a cord blue. So ECG is a basically is a critical thinking plus nursing judgment. So for this, you should know first basic things. So in the ECG, when you see an ECG, there is a PQRS T complex. So you should remember. So in this picture, you can see there is a P wave that is the comes before QRS complex. Then it is followed by QRS complex, and there is T wave. So in normal sinus rhythm, ECG findings are the rate is 60 to 100 beats per minute, rhythm that is regular, P wave that is upright and uniform, PR into is normal, and QRS complex that is narrow. So heart is it means heart is functioning normally. There is no immediate intervention is required. So just continue observe the patient and assess patient always. Okay. Next is sinus bradycardia. So in this you will see their heart rate that is less than 60 beats per minute, and in sinus tachycardia heart rate is more than 100 beats per minute. So now we are starting with each wave. First is P wave. So P wave what it shows arterial depolarization means the what is happening in the heart, the electrical impulses that started in the SA node that travel through the arteria. So it basically allow the arteria to contract for which blood moves into the ventricular. So easy remember P means push, arteria pushing blood into the ventriculus. So if there is no P wave, then it may be problem with arterial problem like arterial fibrillation, arterial flutter. So next is PR interval. So PR interval is the time from the start of arterial depolarization to the start of ventricular depolarization. Means when the electrical impulse is delayed at the AV node, which basically allow the ventriculars to time to fill with the blood. So normal time for the PR interval that is 0.1 to 0.20 seconds. So if there is long PR, it means there is AV block like first degree. So AV node, there is problem with the AV node junction. Next is QRS complex. So what it shows ventricular depolarization means ventricles they are contract and blood is pumped to the lungs from the right atrium, right ventricular and the from body that is left ventricular. So one important thing, see arterial repolarization means arterial depolarization that is arteria contract, then arterial repolarization means arteria that they are relaxing. So arterial repolarization happens here, but it is hidden by QRS. Okay. So next is T wave. So T wave, what it shows? It shows ventricular repolarization. So what is happening? So ventricle, they are relaxed and heart refill with the blood. So if there is very important T wave and questions, Tall T wave, it occurs in hyperkalemia. Flat T wave, it occurs in hypokalemia. So next is steps to interpreting EKG. So there are 5 steps. First step, you should identify the P wave. So first evaluate the P wave. So P wave should be present and it should be upright. So it comes before QR's complex and one P wave for every QR's complex. Okay. Next is identify the PR interval. So PR interval where it is, it's calculate the PR interval. So normal PR interval, that is 0.1 to 0.20 second. Okay. Step 3, identify the QRS complex. So evaluate the QR complex, check whether the every P wave is followed by QR's complex or should not be widened or shortened. So QR's complex normal, if there is any widen and shorten, it may indicate any problem. So normal QR time is 0.06 to 0.12 second. So widen QRS complex is usually seen in PVCs like premature ventricular contraction and electrolyte imbalances and some type of drug toxicity. Step four is identify the RR interval. So in there you can see there is RR interval. So always assess that are the RR intervals that is constant. It should be constant. For example, okay. So check whether they are regular or irregular. So it basically alter the in the bradycardia, you see there PR RR interval that is increase, and in tachycardia you will see RR interval decrease. It means when there is RR interval that increases, it means patient is having bradycardia. So the boxes between the each QR's complex that increases, and in tachycardia the box they are decreasing. So you can remember from here. Step 5, you should determine the heart rate. There is two method and I will teach you the easy one. So first you can take a ECG. So you just look at that ECG and you can see there is PQRS complexes, and in the between there is small boxes. Just count that small boxes. One, two, three, four, five. So there is 5 boxes. So you should divide 300 divided by 5. That means number of boxes and you will get the heart rate. So it's come 60 beats per minute. For example, if there is 8 boxes, so 300 divided by 8. So it is equal to 37, so almost 38. So you can see the heart rate that is in decreasing. So patient is having brady. So for example, if the number of boxes that is 3, so 300 divided by 3 and it is 100. So patient is having tachy. So from this you can remember if the RR interval that is increasing, if that means patient is having brady. If RR interval that is decreasing, it means patient is having tachycardia. So just look at this ECG step. This is normal sinus rhythm. So heart rate that is 60 to 100 beats per minute. Rhythm that is regular. P wave that is upright and uniform, that is before every each QRS complex. And PR interval that is normal and QRS complex that is also normal. Second one, sinus bradycardia. So you can see in that there is RR interval that is increasing. So heart rate that is less than 60 beats per minute. Rhythm is regular. So and P wave that is upright and uniform. It is present before each QRS complex. PR interval is also normal and QRS complex that is also normal. But there is problem only the sinus node that creates an impulse at a slower than the normal rate. So causes in the lower metabolic needs, if the patient is having sleep and athlete training, so athletes always have low resting heart rate. This is because the heart is strong and it pumps more efficiently than a non-athlete. So always remember, and always ask about the athlete having bradycardia. Why? Next is vagal stimulation and certain medications such as calcium channel blocker, beta blocker, and amidrone. So, what is the treatment for sinus bradycardia? If it is asymptomatic, then we will just treat, because if there is symptomatic bradycardia, heart rate is less than 60 beats per minute, and patient is having severe symptom, so we will just give injection or drop-in. Next is sinus tachycardia. So you just see this ECG. As you can see the rhythm that is regular, and there is boxes between the RR. So RR interval that is decreases here. So there is small boxes in the between QRS each QRS complex. So and heart rate that is increase 100 more than 100 beats per minute, and P wave that is upright and uniform that is present each before every QRS complex, and PR interval that is also normal, and QRS complex that is also normal. So just the sinus node that creates an impulse at a faster rate than the normal rate. So what are the causes? So there are physiological and psychological stress, blood loss, fever, exercise, in case of dehydration, infection, and sepsis. And along with the heart failure, cardiac tamponade, hyperthyroidism. So in these cases, patient is having tachycardia. So and apart from that, certain medications such as stimulants, caffeine, nicotine, and some drugs, cocaine, amphetamines, and others like epinephrine, beta 2 agonists, for example, Julin, levosalbutamol, so that lead to sinus tachycardia. So treatment is here just treat the underlying cause that can lead to decrease the heart rate to its normal level. Next is ventricular tachycardia. That is very important for NCLEX point of view. So you can see in the ECG rhythm that rate is 100 to 250 beats per minute and rhythm is regular. So there is, you just see there is only QRS complex that is wide like tombstones. For remember, it's more than 0.12 seconds. And PR interval, there is no PR interval, no P wave visible, only QRS complex is present. You can see in the ECG strip. So it looks like a tombstone. So waveform that are irregular, coarse, and different shapes. So the ventricular, they are equiring and there is no contraction, no cardiac output, which can lead to fatal. So it may be a cardiac emergency. If it is not treated, patient may die. So what are the causes? Causes are myocardial infarction, MI, electrolyte imbalances, drug, digoxin toxicity also lead to ventricular tachycardia. Stimulants like caffeine, methamphetamines, and what are the sign and symptom patient is having? Usually patient will awake, okay, and chest pain, lethargic, anxiety, syncope, severe palpitation. And what is the treatment? So very important treatment. So if there is patient with pulse or no pulse, if patient is stable, that is patient is having pulse, in that case we will just give oxygen, antiarrhythmic drugs to stabilize the rhythm and synchronize cardioversion. That is very important. So cardioversion, it means just giving a shock when the present of QRS complex. So cardioversion is not a defibrillation. Defibrillation is another one. So if the patient is having no pulse, so we will just call it pulseless VTAC. So in this, we just start CPR and advanced cardiac life sports protocol for defibrillation and possible intubation. After that, we did drug therapy like epinephrine, vasopressin, amidrone. So in the VTAC, just remember if there is patient is having pulse, then we will go with cardioversion. If patient is having no pulse, we will just start defibrillation. Okay. If we will not treat untreated ventricular tachycardia can lead to ventricular fibrillation and that can lead to permanent death. So always treat ventricular tachycardia. Next is arterial fibrillation. So arterial fibrillation means the arteria they are shivering, not contracting properly. So in this you can see the ECG pattern. There is QRS complex that is very narrow and it is irregular. And there is rate usually more than 100 beats per minute and rhythm that is irregular. And you can see irregular RR interval here. So where in one step you can see there is RR interval, there is less, and the next one there is increase and mother always increase. So RR intervals it is irregular. PR interval that is not visible, only QRS complex that are visible, no P wave here. So P wave sometime present or sometime not. So, uncoordinated electrical activity in the arteria that causes rapid and disorganized fibbing of the muscles in the atrium. Okay, so that can lead, so arterial, they are basically not contracting properly, and the blood that is circulating in the arteria that can lead to uh, clot formation. So it is very important in the arterial fibrillation question and ask. So the what is the anticoagulant given in that? So in that apexaban usually prescribed for the patient to treat the clot prevention because there is more risk for the clot formation. And if the patient is stable, so we will give oxygen. Drug therapy will include beta blocker, calcium channel blocker, and digoxin. Very important because the artery there are not proper contracting. So digoxin is used for deep contraction of the heart. Amidron to regulate the normal rhythm, and anticoagulant therapy to prevent clots. Okay, because the material that are quicker causing pooling of blood into the heart that can lead to increased risk for clots, that can lead to increased risk of MI, pulmonary embolism, CAV, cardiovascular accident, and stroke or deep vein thrombosis. Okay. If the patient is unstable, then we will go with cardioversion. And next, premature ventricular contractions, PVC. So in PVC, basically what happened, you can see in this the ECG step, there is early or premature conduction of a QRS complexes. In the rate depends on underlying rhythm, a rhythm that is mostly regular but interrupted due to early P wave. And P wave, sometimes it is visible, but depends on the timing of PVC may be hidden. So PR interval usually there is slower than normal, and QRS complex you can see in the ECG. QRS complex that is sharp and maybe it's short or uneven height, bizarre form that is present. You can see there is in the first that is always small and then it's bigger, then it's go down, and you can see there is bizarre pattern of the ECG pattern. So you can remember. So what is the treatment? Treatment in here, just we will patient is mostly in the asymptomatic. So just patient just feel the chest pain and feels like heart that is skipped a beat or it is pounding. So treatment is based on the underlying cause. If the patient is having cardiomyopathy, heart failure, myocardial ischemia, drug toxicity, and that increase workload on the heart, just administer oxygen. It is very important. Then decrease the caffeine intake, correct electrolyte imbalance. And if there is having digoxin drug, any drug toxicity, so just measure out the toxicity level and decrease the stress or pain. Okay. Next is asystole. So asystole, it is very easy. There is no rate, no rhythm, no P wave, no PR complex, and PR interval. Just a flat line is appear in ECG. So it is occur in very conditions such as myocardial ischemia, same heart failure, in hyperkalemia, severe acidosis. So treatment asystole is a non-shockable rhythm, and it is followed by high quality CPR. So just start CPR to save the patient. Okay. So what are the indication of high quality CPR? So heel of the hand on the center of the chest, arm should be straight, shoulder aligned over the hands, and compression it should be at 2 to 2.4 inches depth at the rate of 100 to 120 beats per minute, and that the 30 compression into 2 rescue breaths that is followed. Next one is arterial flutter. So in this ECG step, you can see the QRS complex usually normal and it's on upright. And you can see in the P wave usually present in a sawtooth shape flutter. So in the exam, question are asked about sawtooth shaped ECG pattern in which ECG rhythm shows. So answer is arterial flutter. And the rate that is 75 to 150 beats per minute and rhythm usually regular. Just present of P wave as a shape of sawtooth shape. So what it is similar to like arterial fibrillation, but the heart's electrical signal that spread through the arteria, heart's upper chambers, which are beating too quickly through a regular rhythm. So in the treatment that is same as Arterial fibrillation. If the patient is stable, we will give drug therapy, oxygen and calcium channel blocker, beta blocker, and anticoagulant. That is very important, and antiarrhythmic drugs like amidrone. And in the unstable patient, we will start cardioversion. So next is ventricular fibrillation. So you can see in this tab there is rhythm, that is rate, that is unknown, rhythm chaotic and irregular. So and there is no P wave, no PR interval, no QRS complex. So there is rapid disorganized pattern of electrical activity in the ventricular in which electrical impulse are arising from many different points, different foci. So there is no SA node and AV node is present, but there is other than more than many different foci is also present. They are also generating impulses. So it is life-threatening emergency. So just treatment is just start CPR and it is followed by defibrillation. So if trying to prepare possible intubation tray should be ready and drug therapy like epinephrine, antiarrhythmic, amidrone, lidocaine. And so NCLEX point of view, you should remember if there is VFAB, ventricular fibrillation, go for DFAB. Next is supraventricular tachycardia. So as the name suggests, supraventricular tachycardia. So there is tachycardia, so rate that is in more than 100 beats per minute. Usually it's 180 to 220 beats per minute. And rhythm, it is regular. And you can see in the ECG step, there is boxes, always small boxes. It means so there is tachycardia and supraventricular QRS complex that is very narrow, less than 0.12 seconds. PR interval unable to identify because there is no P wave present in this step. So P wave as no P wave. So supra means above. It occurs as extra and abnormal electrical activity above the ventricular and AV node. So patient is having manifestations like hypotension, low BP, shortness of breath, dizziness, chest discomfort. It is causes for that it is accessory or extra electrical pathway, for example, Wolff Parkinson White syndrome. And there is re-entering of the electrical signals from the ventricle to atria. So no, usually it is not happen because the SA node that is present on the atria, then it goes to the AV node, then bundle of His and Purkinje fibers. For treatment, if the patient is stable, so then we will go for Valsalva maneuver. So Valsalva maneuver is in what happen in this, we will teach the patient to hold their breath and bear down as it if is having a bowel movement. Then it basically lowers the calm down our sympathetic nerve system. Next is carotid massage because carotid massage it is the vagal maneuver. It activates the parasympathetic nerve system and relax the heart. Next is cold water or ice on the face. It usually help to relax the heart. And if the non-pharmacological treatment that does not work, then we will go for ABCDs for supraventricular tachycardia. A for adenosines, beta blocker, calcium ablation, D digoxin. And if patient is unstable, we will follow with cardioversion. And one important thing, we will give adenosine very rapid push and flush with NS because heart rate may stop. And one important thing, which medication should be held 48 hours prior to an elective cardioversion for supraventricular tachycardia. So it is digoxin because digoxin due to increased ventricular irritability. So next is client with supraventricular has the following assessment. For example, heart rate is 200 breaths per minute and BP is 78 by 40 mmHg and respiration rate that is 30. So what is the priority action? So priority action is synchronized cardioversion. So what is very important? So supraventricular tachycardia means cardioversion is repeated because patient is having severe low BP and heart rate that is very high. And next one that is thoracic deep points. So in this you can see tornado like heart rate rhythm is seen and cause for it is post MI hypoxia or low magnesium. Low magnesium, that is very important in magnesium. So treatment that is NCLEX important is magnesium sulfate. Mostly patient is having low magnesium, thoracic 3 points can occur. So just give magnesium sulfate to the patient. So NCLEX important terms, if P wave means arterial rhythm, QRS wave means ventricular rhythm. So question, if there is lack of QRS complex, just remember asystole, and wide bizarre QRS complex, that means ventricular tachycardia. So third is chaotic or unorganized rhythm, that is fibrillation. Chaotic or unorganized, that is fibrillation. So question usually are chaotic rhythm with no P wave. So no P means arterial, so that is arterial fibrillation. Chaotic rhythm without QRS complex, that means ventricular fibrillation. Fourth one is bizarre. Bizarre it occurs in tachycardia. So question, bizarre rhythm with wide QRS complex, that is ventricular tachycardia. Sawtooth that occur in arterial flutter. So if you know these, you will pass the NCLEX on ECG.